Thank you so much for sitting down with us, Julia. I'm excited to get into just speaking about children, kids, but also the work you do, because it's very interesting. I haven't come across a lot of people who work within a hospice environment, but when it comes to children. So it's going to be a great time kind of sitting and unraveling that. Can I ask you, as a doctor, you are in this space. It's not one that I've really heard anybody going into. What made you decide to do this?
Sure. First of all, thank you so much for letting me be here. I train, I'm much older than you. I trained as a junior doctor in the height of HIV, where there were no ARVs available. And every night I would certify numerous patients dead, adults, children, elderly, and there was nothing I could do to help them, nothing at all. I felt completely ill-equipped. I trained at UCT, where the HIV rate was quite low. Good.
I'm sorry, just as soon as I hear UCT, I always get excited.
Coming back to Durban, where HIV was sort of 50%, prevalence at that point, it was really hardcore.
Sure.
Then a few years later, I had an opportunity to work in the UK, where they've actually got a whole thing called palliative care, and it's literally learning how to make people comfortable when they have serious illness and learning how to manage their needs. So when other doctors are saying there's nothing left that we can do, suddenly there's a whole other wide range of things that you can actually do. Yeah. So it was immediately attractive, and so I headed down that path.
And I mean, here you are today sitting opposite me, and I'm really trying to get into this kind of mindset, because with the training I have come across kind of end of life care, they tend to sometimes tag it with the geriatric population, people who've lived a life. And so when it comes to, okay, we can't do anything to maybe get rid of this illness, but we can allow you to transition through life and to really have the best possible quality of life within the time that we can get you with regards to management. How do you approach it when it comes to children, when it comes to their mothers? It just feels like it would be something that is very complex.
It is complex, because you're dealing with the sick child themselves, and you're dealing with the parents, and then you're dealing often with grandparents and extended family, where they're all invested in the child. Yeah. And it doesn't feel fair, right? It's not the normal way things should be. Yeah. Definitely parents should die before their children. Yeah. But at the same time, everyone is affected by illness at some point. And yes, it happens to be sometimes that it's children, sometimes it's newborn children. So for me, when it came to working with kids, I just absolutely adore working with children. I find them much more honest than adults. And it was just a space that really appealed to me, to be able to kind of connect with a child and then understand the parent. And it is complicated, but the themes are the same, right? It's about making sure that good decisions are made, so that children are not trapped in hospital when they could be at home, where they could be seeing things with their family for the last time, where they could be surrounded by love. So it's really the same principles, but just more and obviously very emotional for everybody involved.
Of course, and you are speaking about that emotional component and just talking about it from a psychological perspective. It's very interesting, because I guess you have children and the ages vary when it comes to which children you're going to be kind of helping and treating. But the psychological element with regards to the mother, the family, as you were bringing out, that's part of the management plan I'm assuming you tend to have. How does that management plan kind of look when they refer somebody to you?
Well, we really sit down and try and work out the goals of care. And we always sit with the parents first, because that's the way decisions are made for kids. Obviously, teenagers, it's a little bit different, and we do see a lot of teens. We work from 0 to 18. But we sit with the family and we really talk about their experience of the illness. Where are all the hurts? Where are all the aches? Because it's not just about the disease. It's about their relationship with God. It's about their relationship with each other. Moms and dads frequently fight because the pressure and the pain is so intense when a child is very sick. So that the issues may be psychological, spiritual, emotional, social. The financial aspects of illness are enormous. So for us, we just sit down and try and get a real feel. We call it impeccable assessment, where we're looking at the whole family. Really, what is the stuff that this family has? And then bit by bit, we refer, or we just choose to work on different aspects. But the idea is we never take away hope. We spend a lot of time hoping for the best. but preparing for the worst.
Sure.
And so if a family is praying for a miracle, we pray for the miracle. We hope it's going to come.
Nice, yeah.
And if it doesn't come, we know what we're going to do. We're going to make sure that your child is comfortable, that the pain is managed, that the spiritual aspects are cared for, etc. So it's really about the assessment and then managing each need individually.
I mean, just listening to that, it feels, because I know within the medical space, there's always a want, well, not a want, there's an inclination to, because you go in, it's a vocation, you feel, and you really want to help people, and life kind of wears away at you because you become a bit more jaded. You almost just want to be like, okay, I'll see this person as this illness, and I'll just do the management that's written down, and okay, this is what happens when you have diabetes, and in this particular realm, you really need to engage, and you're engaging with children, which already for me is a spot where I tend to always want to go the extra mile. How do you balance that in terms of not getting too engaged with the family, but also giving them the best possible care you can? Because I find that is probably incredibly difficult.
Yeah, I think it's a lifetime of practice.
That's just like for me, I was like, oh my goodness.
No, I believe that we should actually do this for every patient, whether they've got diabetes, whether they're going to survive. You know, I don't think we give patients enough time and energy and empathy.
Sure.
We don't listen to patients, maybe because we are jaded.
Yeah.
And I certainly work with a lot of very burnt out doctors who are jaded and skeptical and perhaps not as invested as they used to be, which is sad. But I think when we step back and say, let's talk about what's in the best interest of the child, and I firmly believe that there are worse things than death. I really think that dying is not the worst thing that can happen to someone. I think living a horrible life is far worse than dying a comfortable death. So I think because I've wrapped my head around that I don't have to save every life. I mean, my children think I'm a terrible doctor because I don't save lives at all anymore. I tease, but really at the end of the day, it's about recognizing what matters to people and helping them achieve that, whether they live or die. And I think if we all practice medicine a bit more like that, our care would just naturally improve.
But I mean, that's such a beautiful perspective, because you go, death isn't the worst thing that can happen. So that means I can treat you by giving you the best possible quality of life. So in essence, you're actually saving them from hell on earth, which I think is just such a great way of framing it in my mind, and I guess you've done so in your mind. Now, I know about Make-A-Wish Foundation. I think a lot of people have heard of that. I have always heard about it internationally. Do you have something like that within our space when it comes to children, making some of their wishes possible?
We're very, very lucky to have something called Reach for a Dream. They're an awesome organization. They'll see any child that is able to communicate their wish. And mostly it's cell phones and laptops these days, but they still do sort of be a princess for a day or meet a famous superstar. And they really do, you know, bring a bit of joy and light. And especially in our situation where most families are in abject poverty. One little boy was recently treated to a sort of morning at an arcade, and he'd never been. And the videos of him playing on the cars and playing the games, and you could just sense this incredible moment for him that he'll remember forever, and his mother will remember forever because she's never been able to do that for him. So yeah, there is joy always to be found.
I was going to ask you, because I always wonder, because kids can think of some of the craziest things that they wish could happen, and it's like, oh, you have a wish, let us know what your wish is. And I mean, that one sounds like it's at least simple enough to fulfill, and you can see the wonder. What is one of the more crazier wishes, or the dreams that a child has said where you thought, okay, maybe not possible?
Well, certainly the one child wanted to go to Paris, and unfortunately budget does not allow, so it wasn't a wild dream.
But it was Paris, don't we? Paris.
I don't think that's what she had in mind. All those pictures of Eiffel Towers she's drawn me over the years. I don't think they have one in Paris. But yeah, I think the one of the hardest things is I always have to sign off on the dream. And so a child who's almost bedbound, perhaps with a brain tumor or seizures or something like that, is asking for a bicycle. And I find that really tough, because we have to say, no, dude, that's not going to work. Let's find you something more fun that you can actually enjoy now. So there's a full range.
Sure.
but nothing too wild or crazy yet.
Listen, I'm almost wishing I could figure out a way to get an Eiffel Tower in Paris, because then we're in a whole other realm there. We can make a lot of dreams possible. But you have touched on something that I find is very interesting, because there is the heart element to it, and they always say you pour into others, but you have to have yourself poured into as well. Our health realm is quite an intense one. The hours are intense. You find people who really want to do good work, but they just don't have the capacity. Or in cases like this, it's seeing different faces that you're trying to help, but you also need to figure out a way to process that yourself. Are there ways that you do it with your team that you can kind of help them? Is it that they see psychologists, psychiatrists? What are the ways to make sure that you're processing all of these emotions and these cases that you come through, especially with the junior doctors that are in your care?
It is really tough. So we teach a lot about daily practices like journaling or mindfulness, and I'm amazed when I meet a fifth year medical student who's never heard of mindfulness. I'm like,
it is the thing to know. Yeah,
it is the thing to know.
Yeah.
So I do teach at the university, and so I teach across the 4th, 5th, and 6th years, and so I get to know the students quite well, and really try and encourage them to develop their own self-care routines and to prioritize it. I think doctors are very good at talking about it.
Yeah, I can
advising it.
Yeah, I can rattle off a whole bunch of things that are just great for optimizing mental health and physical health,
but not actually doing it. Yeah, and I think it's about making decisions. It's again at the end of the day, you have to decide how are you going to run this. How are you going to be the doctor you want to be for the rest of your life without burning out? You've got decisions to make, and you need to make them early, because for a lot of, I think what they're seeing as younger doctors, they're seeing the older doctors who are burnt out, who are thoroughly unpleasant.
Yeah.
Who are still operating in a hierarchical way with lots of toxic, hierarchy going on. And I think when you've experienced that from an older doctor, and I mean, I'm not saying old, but older, you might be more inclined to look after yourself. So I think we're in a beautiful place now in the world where we can actually talk about this, where mental health of healthcare providers has become much more prominent, much more awareness about doctor burnout, about nurse compassion fatigue, and I feel truly privileged that we're working now and not when I was an intern, because it's a very different place now.
It really is, and I think the hierarchy is the best way to kind of describe it, where things just, you get told and you do, and you're a soldier, and this is just how things end up. And in situations like this, especially within disciplines and kind of fields where they're not just children, they're parents, they're all of these nuanced ways of doing medicine, which requires you to really be engaged. That means you can't always use the old school ways of doing things. But outside of us as healthcare professionals, if somebody's at home right now and they have a child and they have the unfortunate situation of trying to process hearing a diagnosis like this, or a prognosis where the child is not going to be able to make it, what are some of the ways you've navigated and key principles that you've kind of helped them, be it resources, be it framework, how to think about things, or just people they can go to try really process what's going on?
I think wherever possible, finding the support groups. Most of our families go onto Facebook, go online, and find some kind of other parent that is experiencing a similar thing. We've got an organization in South Africa called Patch South Africa, which is a wonderful network of palliative care providers across the country, and there's a community arm there. So sort of tapping into the resources that are available and making sure you understand how to manage your health provider. When you've got a child with a chronic illness, upskill yourself so that you can manage your team the way you want to. And then I think other things like managing family. So WhatsApp is a wonderful tool, but families, when you're getting messaged every minute saying, how is he? Is he any better? And you want to say, no, he's not better, he's worse. Sort of managing your own space and time with your child, with your family, prioritizing you, and maybe sending out broadcast messages, kind of those little things we talk about. And then also with the families, looking at psychologically, how do you look after each other and how do you take care of the siblings? Because when there's a sick child in a family, the siblings are often forgotten. The parent focuses all their attention on the sick child, which is completely understandable. the sibling feels like all jealous and, you know, and sometimes have confided, oh, I wish he was dead, you know, and then realizing that's a terrible thing to say, and then the guilt kicks in. So helping parents to understand what the sibling might be going through, what the child might be going through, helping them navigate that space just by talking about it. So we always recommend some kind of social worker or psychology support, and in our team we have a social worker who is brilliant for that. And really recommending they tap into resources online, because most people we work with have some kind of smart device now, or at least access to it. Through younger children, I mean older, you know, siblings, or whoever's got a phone, somebody's got a phone, you can get on and get information. So really upskilling yourself.
I mean, this is the beauty of like holistic care. It's not just the old school ways of just making sure that you've kind of ticked boxes, but you make sure that you tailor your management as well as your thought processes around families, and that makes it quite a tailored management plan. It is about vaccination awareness this week, and I would be remiss if I didn't ask your opinion around vaccinating newborns and the benefits that are there, because I think a lot of people just think things are done because they've been done that way for years, and they go, well, maybe if we don't do it, we'll find that the way we've been doing things is actually not optimum. Why is there a need for people to be aware of vaccinations and vaccinating newborns?
I think a lot of thought goes into what should be in the schedule, and it's also balanced up against how much it costs. So I do think anti-vaccine families I've chatted with, kind of big pharma's just going to get money from this, and there's a lot of suspicion. But actually rolling out a national vaccination campaign for every child in this country is a huge undertaking. And if it wasn't worth it, I don't think anyone would spend that money on it. So for me, just to set the scene and say this is something that is well thought out. And if I just look at how the vaccine schedule has changed since I was a baby doctor, you know, one of the things I saw a lot of was pneumococcal meningitis. Exceptionally common when I was a junior doctor. Like it was overwhelming, and it caused massive brain damage, hearing loss, loss of life. But those that survived with a severe disability. And so much of that has gone away because of the vaccine schedule changed, and kids are now being vaccinated against it. So, you know, we've watched the vaccines really have impact in my lifetime. I mean, I'm not that old.
No, you're not.
But even in that space of time in my practice, I've witnessed how important it is to vaccinate your child and to really understand what it is you're vaccinating against. So the schedule is well thought out, it's planned, it's designed to work the best it can. Not everything that is available in the private sector is available in the state hospitals, but a lot of the basics are there. And even now, right up to the HPV vaccine, which is the human papillomavirus, you know, cervical cancer is still one of the biggest killers in our country, in the world, in fact, of women. And if we can start vaccinating our, you know, late tweens, our early tweens, I should say, sort of 10, 11, 12-year-olds with that vaccine, it's going to have massive impact in terms of the numbers of cancer we're seeing in future. So I'm obviously a firm supporter. Was very upset with the discussion that came out, that the chap who wrote the paper on, you know, the MMR vaccine causing autism. He's been struck off the roll. The people who supported him then have all withdrawn that support because his study was not valid. And he did so much damage at that time. And I'm hoping that people are starting to really, if you're going to do your research, right around it. Don't be selective about the articles you read, because I think that's the problem with the internet. You can prove anything you want.
You just have to select. You can always find the statement that corroborates your statement, because there's so many things that are out there. But I can clearly tell there's still that passion, that fervor that you had, as you say, when you were a baby doctor. I feel that aura of baby doctorness that's there. And I think it's really beautiful. It speaks to the fact that you've been able to weather the difficulty of being within a hospice space and still feel passionate about children living the best possible life they can. And that's what vaccination is about. It's about making sure that you aren't shortchanged by things that we can prevent. You can't prevent genetic issues that might be there, but things that are preventable, especially over the years of information we've acquired as a race, should be prevented against. And I think it's beautiful. I also very much humbled by the amount of energy you have when it comes to speaking about giving the best quality of life to children who might have kind of end life treatment that they need. And I just want to ask you, if I wanted to help Reach for a Dream, or if I know Patch, you said that that's the network, but Reach for a Dream is very much about making those wishes possible. How does one do so?
Well, I think one can sort of Google them, find
Okay.
them on, if you can find Patch on the website,
Sure.
you can find Reach for a Dream on the website. There are all the ways of getting involved, either if you're able to provide services, if you don't have cash, volunteering, there's always activities that are happening. Social media pages are full of it. So I think it's not difficult to find out how to help.
There you have it, from an exceptionally big heart and an aura that I'm pretty sure even all of you can feel. And she keeps saying, oh, I'm a bit of an older. She doesn't look it, neither does she move it. It's been a great episode, speaking about something that can be seen as difficult by some, but honestly a beauty in that you can really give somebody the best possible life they can for however long they live. And that's another episode of Medshield Movement Connect show with me, Dr. Fez. Enjoy the day.